Well, thank you. Thank you. I think I'll start directly now. I will tell you a little bit about one of many achievements we have made through the Recruit and Retain project and Making It Work project. And what I will talk about is the rural stream of the medical school.
Next, please.
Next slide. And next slide. And you can take next slide too. Thank you. And this is a pilot when Umeå University works together with Region Västerbotten. And this picture shows a little bit about the distances in our area. This is remote Sweden, but maybe not compared to Northern Ontario. But nevertheless, our medical students that we have in Storuman now have 3.5-hour bus ride to Umeå and the university. Next slide. This is how the medical education is organized in Umeå University Med School right now. From term 6 to 11, there are clinical courses until now based primarily in hospitals. On term 10, there is time for a thesis project. And the time spent in primary care during the clinical courses is only about 5% in this curriculum. Next slide, please. The students can choose already today to do their clinical terms in 4 hospitals. Many of them remain in Umeå where the university is, but some are going up to Luleå north and some are going south to Sundsvall and west to Östersund. But there are still only hospitals involved. Next slide. During the first Recruit to Retain project, we invited Professor Roger Strasser to talk to Umeå University and stakeholders within the region about the advantages with clinical and medical education in primary care, especially in rural and remote areas. And we worked parallel to that with a visionary document that we wrote for the next 5 years, and we could incorporate this work that Dr. Strasser had done in this document. Next, please. And there are also a discussion now in Sweden to extend the medical school program from 5.5 to 6 years. And there are discussions now, especially in Umeå, if we can increase the clinical training in primary health care. Next slide. So what is now coming and have started already is a rural stream or a rural track. And we have now 2 students every semester starting from term 6 that are coming to Storuman to do their curriculum and to the small rural hospital in Lycksele. This means that they will have almost 10-fold increase in rural medicine exposure. They will have the same learning outcomes and assessments tasks, but we are doing this over a period of 4 years. Next, please. So this is how it would look like. They will do family medicine, of course, within primary care, but they will also do internal medicine, surgery, psychiatry, family medicine, of course, general obstetrics, and so on. And for me, from a Swedish point of view, I think this system is probably one of the most valuable achievements we have had in Sweden in this project. And I hope and I think it will increase the amount of rural GPs in the future. To change a university isn't easy, but we have done it with help from our friends, which is really, really great. So, Niklas, introduce next speaker.
Yes, thank you very much. Thank you for the next slide. I could say that the focus in the framework is here training future professionals, and creating this rural stream, as Peter told you about, is one part of our business case study that we have done here in Sweden. Another case study that is carried out by Storuman municipality is going to be presented right now, and that is related to relocation coordination officer. And Tina Carro, please.
Thank you. Next slide. My name is Tina Carro, and I manage a pilot project run by Storuman municipality. The 2 years project will be test several operation actions that are based on studies and research, some which come from the previous recruit and retain program. Various success factors for recruitment and retaining those who have established themselves here will be tried and tested. We call our department the relocation service, and I am the relocation coordinator. I began my position in August 2018, and it was clear from the start that there are several methods that can be looked at. As you all know, there have been many job vacancies over the years that have been difficult to fill. We are also aware to the fact that over the years, more people have left the municipality than have moved in. Next slide. The first major operation we tested was to send a postcard to 1,450 individuals between the age of 20 and 55 who have left the municipality during the last 10 years. This was based on studies that showed that there is a target group that could consider returning after spending time away from home. 180 postcards were returned due to the incorrect addresses, which means that 1,270 received the card and its positive message. It explained that the municipality was currently in a positive expanding phase and could offer attractive employment opportunities. It also highlights the wide range of active clubs and associations that proved a meaningful leisure time. Next slide. In conjunction with sending out the postcard, we also put a form on the municipal website where individuals can register their interest in the area. I then make contact with those who request more information. Sophia filled in the form. She is a highly educated person who grew here and chose to move in order to study, and then moved even further away to a job that utilized her skills. She has always had a desire to return at some point, but could not quite find a way in which it would work out. The postcard gave her the impetus to try again, and now Sophia has made up her mind. She's coming home. Next slide. Relocation service has an incredible important role to play in recruiting and retaining individuals. All activities are focused on sustainability and the notion of working together. The community is the collective spirit of those who live here. Everyone is important. Working with recruitment requires that we cooperate and head in the same direction. We understand that we need to operate not as individuals, but as a team, and that is why we will succeed. Thank you.
Thank you very much, Tina. I can see that we're even on track on time now, so we are going to leave back to you, Roger, for you to introduce the next speaker. So, Roger Stresser, please take us forward now in this.